believe that patients were created by God with a body, a soul, and a spirit.
I've seen a lot of miracles happen there, and I've seen people celebrate the healing of their wound.
The best way to take care of patients with chronic wounds or with difficult to heal wounds is in a wound care institute.
St. Francis Wound Care Institute deals with a variety of wounds: arterial ulcers, venous ulcers, pressure ulcers, diabetic neuropathic ulcers, post-surgical wounds, and trauma wounds.
Patients come from Missouri, from Chicago, from all over. We get the worst of the worst. When they didn't heal, perhaps at another wound care center.
They was going to cut my foot off, and my daughter, she went and said no. So she brought me over here, and in 4 months, it's healed.
Many of the patients who come to us have had wounds for many years, sometimes over 30 years, if you can imagine that. And they don't believe that their wounds will heal. And so our job is to show them very quickly, by the things that we do, that that wound can get better.
He just looks like a different person, I'll tell you.
I am a new person.
I think that the proper care of wounds requires multiple approaches to the same patient. In the past, and in other institutions, they'll try putting something on the wound, they'll maybe try cleaning the wound, but they don't treat the entire patient. You have to treat these through multiple modalities. That's the only way today properly to take care of a wound.
The 7 principles of wound care that need to be done simultaneously are the following. First, when we look at a wound, is there anything on it that needs to be removed? Dead tissue that we debride.
You cut away callus, you cut away dead tissue.
Second, if there's infection, we need to treat the infection.
Stuff like I would have.
Third, is there blood supply to the wound? If there's no blood supply, there's no oxygen, the wound won't heal.
I think our plan today is we want to check your blood flow, so we're going to do a procedure called an ABI, and it won't hurt.
What about nutritional support? If you don't provide energy and protein, wounds won't get better.
Hey, Debbie. Good morning. How you been eating?
Good.
Appetite's okay?
Appetite's fine.
The mental status of the patient is critical. They have to have hope. They need to believe the wound will heal.
Looks very good.
Well, this should really help protect it.
Well, it already feels better.
I can smile now.
We look at accelerated technologies to say if a wound normally would heal in 3 months, what can we do to make it heal in 6 or 8 weeks?
There's a lower intensity you use.
We then look at dressings and mechanical pressure relief.
This is called Curlex to help secure it on there. How does that feel?
Those are the 7 aspects of wound care that we do simultaneously.
Teamwork for wound care involves bringing together different specialties, including general surgery, vascular surgery, infectious disease, nutritional aspects as well, in addition to the technical and nursing support needed for actual dressing changes and detailed care of the wounds.
Hi.
When we talk about team, yes, there's a core of experts here, and we run the gamut of all the expertise you need, but the real team concept comes in incorporating the family and the patient and the treating physician in that.
A lot better. All done.
Well, I realize I take a personal interest, but I think that here at St. Francis, the Wound Care Institute, as it has evolved, can treat wounds as well as any place in the country.
When you're a physician or a family member, the bottom line is results. And that's what we can provide here at St. Francis Hospital.
Your length was 3.7. Last time you were here, it's 1.7 now. We are very committed to the patient and to the referring physician. We are committed to healing the wound.
Well, being a part of the wound care at St. Francis is very exciting. There's the enthusiasm that's here just gets into your soul.
Well, I don't think anything makes me feel better than when I see not just a wound heal, but a patient literally changed. And they're no longer withdrawn and afraid to do the things that they want to do, but they can go on to live a normal life, and they know if they start to have problems in the future, we're here for them.
God's work is alive here in this hospital, here in this wound center among these people. God is alive.